Welcome. We're glad you've joined us. This video, Integrated Healthcare at the Point of Care, is for all audiences, but with a special focus on offering information to providers to help create a shared understanding of some of the key practices and tools needed for delivering integrated care at the point of care. In the not too distant past, and even a little bit currently, a person often receives care as if their emotional well-being was somehow separate from their body. We even set up the system this way and required individuals to go through many hoops to obtain the complete care they needed. Now, unless you've been on a very long needed vacation, we have collectively learned and know that to see an individual and treat them as if their head was actually connected to their body is a better way to go. We even have terms that describe this: integrated care or whole person care. As most of you likely know, Access has been on a multi-year journey to integrate healthcare. And you've also likely seen the step diagram showing Access's multi-year approach to integrate physical and behavioral member benefits into a single health plan. This is taking effect for different populations over an extended period of time. The intent is to advance integrated care by having one health plan rather than two. Be responsible to provide integrated care or whole person care by addressing physical and behavioral health as well as linkages to social services. Now, alongside these multi-year efforts to integrate members' physical and behavioral health benefit, Access has supported other initiatives to advance integrated care or whole person care at the point of care within the delivery system itself. Some examples of this includes Access's Targeted Investment Program, also known as the TI program. This program has been a multi-year strategy to assist providers to develop structures and processes that address whole person care. The TI program includes the use of financial incentives for developing structures for integrated care, and most recently, for meeting healthcare outcomes. The TI program also included a quality improvement collaborative in which providers have the opportunity to learn from each other and try new ways to incorporate practices and tools to achieve better outcomes. Another example of supporting efforts at the provider level includes Access's differential payment approaches, which provides incentives for providers that have committed to supporting designated actions that improve patients' care experience, improve members' health, and reduce growth in the cost of care. Providers around the state have engaged in these and many other efforts to continue to advance integrated care. Providers have been making progress in big and small ways, continually advancing integrated care. Access encourages the continued evolution of integrated care throughout the Arizona delivery system in order to make a difference in the lives of members and their communities. Let's take a look at some integrated or whole person care practices and tools that Access encourages. Let's first take a quick look at all of them, then we'll go into each one a little more. The integrated practices include whole person and well-being focused care, a focus on the overall life goals of a member and family, not just looking at physical health. Connect and collaborate with the member and other providers, supporting change and innovation, continually learning and adopting new practices. In order to enhance and sustain these practices, you will have access to many tools and outcomes data. By treating the outcomes, we create incentives to maximize and sustain these gains. So let's go a layer deeper on each of these concepts. Think back over the last week or two and envision a patient who had more than one problem to deal with. I'm sure you're thinking, I don't have to go back more than 2 hours to think about this person. And while they came into your office or center to address one main issue, as far as the chief complaint was concerned, they shared all the complexities of their life that ultimately seemed very disconnected from the initial purpose of the appointment. While all of these issues may seem disconnected from the initial issue, we all know that it is nearly impossible for someone to worry about counting carbs if they don't have access to consistent food, that the next scheduled follow-up appointment is worthless if they don't have transportation to it, We all understand that whole person well-being focused care requires us to understand these complexities. Most of us would agree we need to understand all the interrelated pieces of the puzzle a member is conveying about their life. In fact, most of us now understand that in situations where they're not sharing these pieces, it's upon us to discover them and ask about their lives, not just write a prescription and hope they get it. We need to understand things like their cultural background, which may encourage or discourage seeking help, any kind of help. This question is, how do we manage to get this done? Fortunately, though, integrated care approaches, we do have to do this in a way that incorporates a team. We don't have to do it alone. Imagine in this last scenario, if the person sharing all kinds of information, that you could pull in a whole support team that would give you the ability to handle those collective physical, behavioral, and social issues that make things more complex. Imagine being able to link a person and their family to the needed resources to address challenges like housing, transportation, vocation, or food insecurity. Now imagine that you have access to a team of different professionals and support workers that can be put together to bring different expertise to better address the needs of the whole person. As we continue to evolve integrated care, we will be able to coordinate the solving of these all too common conundrums. We'll be able to focus on improving the health and well-being of a person rather than just making sure that they receive the evidence-based medication or the basic education around how to utilize those medications. We'll be able to do something that we've always wanted to do, which is really just make their life better by focusing on continuous progress toward better health and well-being. Let's hear from a provider who has implemented many of these strategies to support the connect and collaborate approach by expanding their team.
Community Health Associates has worked hard to retrain our behavioral health staff to look at integrated care and whole health, so they're not just addressing the behavioral health needs, but also the medical needs. In our clinics, we now have medical providers working alongside the behavioral health staff, so that a behavioral health technician who's completing an assessment may become aware of a medical issue and can just immediately walk that person right down the hall to see the medical provider and get those medical needs taken care of.
Regardless of your role in this, whether you're a primary care physician, a specialist, a front desk support person, behavioral health tech, a licensed clinician, peer support specialist, or a community health worker, the building of an integrated system of care will allow you to be more effective at your job. If you work at a large health system, a small primary care office, a peer or family-run organization, or at a behavioral health provider, we can utilize these common integrated practices to better the lives of those we serve on a daily basis. Let's hear from another provider, Happy Kids Pediatric, who also has implemented strategies to support the connect and collaborate practices approach by expanding the team makeup, just in the reverse from the other provider we heard from.
Happy Kids Pediatric, like any other primary care, we're referring patients to the different behavioral health care organizations. We decide to be an integrated clinic. Right now, we have 3 clinicians. The biggest difference between now and then is how happy the members are to be able to schedule an appointment fast, sometimes in less than 24 hours. The providers are happy to follow up with the patients sooner than back in 2015. The integration is the path to deliver a better quality care for all the patients, not just at Happy Kids, but in all other locations.
While a lot of this sounds fanciful and even some unthinkable, the system is moving toward utilizing evidence-based integrated practice approaches, such as focus on whole person care and well-being, as well as improving the ability to connect and collaborate with all of those needed to stabilize and improve a member's environment. Members have shared their experience of what it's like to receive care from providers that have embraced these practices. Here are a few things that they've said. Quote, "I love the fact that they have reached out to me to check on the health both mentally and physically, of my daughter and myself. Quote, I love my health team. Or, I knew who to call for any questions. My provider is always helpful and a good listener and cares about my son's mental health and overall well-being. And the program provided me with a foundation to better my life like I've never imagined. As we've said before, all these practices are interconnected. These statements certainly demonstrate the concepts and experiences supporting change and innovation. This includes continually going the extra step, making the outreach call for a proactive approach and for follow-up. Trying all this together, you can see, this can be accomplished by having a team rather than a bunch of individuals. Knowing that members are telling us what works for them and seeing some of the evidence of outcomes, we must embrace not only looking at a patient's foot issues or their challenges from depression or anxiety, but looking at the whole person. Continuing to build the system so that either you or another health or social service provider can address these needs in a comprehensive and accelerated fashion. We want to be able to effectively collaborate in order to improve a patient's well-being. We learned long ago that being co-located does not equal being integrated. We can use techniques like co-location, but the connection and collaboration between us as providers is the glue that makes the difference in continuous improvement of health and well-being. We've talked about several integrated practices and how they all, in reality, work together, not as separate, discrete pieces. Let's think about an example. Remember when you first learned to drive? All the pieces were separate. The accelerating, turning, seeing behind you all seemed so awkward. Likely now, hopefully by now, you haven't thought of these things or how they work together in a long time. For some of us, a really long time. But isn't that great? We all do this without too much effort anymore. Integrated practices are like that too. One day we won't even need to think about the pieces, they will just work together. Let's look at another more pertinent example of these activities, and how they come together. So remember when you first heard the term health home? Or when you first heard another provider saying that they were a health home? Now, if you're like me and so many others, that's a great example of us trying to learn to drive a car again. Not only were we trying to drive the car, but we had not even really agreed on the definition of what a car is. So now we've defined health homes and ways to implement them and utilize all three of these integrated practices. This is definitely one area that we can lean into by supporting change and innovation to more fully embrace health homes in communities across Arizona. These health homes can be based in many different provider sites, integrated clinics, physical health, or behavioral health. In the health home, you can identify a point person whose role is organizing care and facilitating a team. These individuals' scope of practice is much less important than their role of the point person. We all know the many different titles out there like care manager, case manager, community health worker, and the list goes on. What's important is that the member and team know what the health home is and who a member can count on to be their point person. As we move forward with integrated care, the concept of health homes can be one area we all focus on to support change and innovation and continuing to develop our integrated practice skills. In order to accelerate and integrate these concepts into reality, the system must be ready to support change and innovation. This will include both providers and payers initially stepping out of their comfort zones and trying new ways to support members' health and well-being, creating and trying new processes and new technologies that may at first feel pretty complex or difficult to fully integrate. These approaches should include continually taking an extra step to support a member and their family and understanding any social needs like transportation problems, housing instability, or lack of access to healthy foods, or even things like developing improved family relationships or how to find and keep healthy social companions. So let's hear again from Matt at Community Health Associates and hear how they have changed practices to connect and collaborate within their organization and with a peer and family-run organization.
There's quite a few different changes that we made around connecting and collaborating. Community Health Associates has partnered very closely with peer and family-run organizations. Our partners with Hope Inc. and TLCR provide peer support so that when folks are taken into our program, we also immediately try to connect them with those peer supports, people with that lived experience who've been there and done that, who've gone through what they've gone through. Another huge part of it has been connecting our behavioral health technicians, our behavioral health teams, with our medical team, but then also having interdisciplinary team meetings, not only with psychiatric professionals, but with medical professionals as well. It's been remarkable, and we're very happy with the outcome so far.
So let's shift our attention slightly to take a look at some of the integrated practice tools. The evolving integrated system will work to actively support the change and innovation that we have always wanted. By utilizing integrated practice tools such as real-time electronic data sharing, self-service tools that are patient-facing, decision support help, and the technology to facilitate prevention and health screenings, we will continue to move forward to what promises to be a bright future in healthcare. Given the pace of how healthcare is delivered today, it is important to lean in on the technological advances of the communication and collaboration tools, using these capabilities so that we can bring in the member, their family, and the team of service providers to be a part of their care. A truly integrated approach actively outreaches to members using all kinds of tools, including welcome calls, social media engagement, and really improved gamification of their healthcare. These integrated approaches have to include supporting members and their families in navigating what is a very complex system with an unending list of services and supports. And that's if they actually knew about them and were able to access them. In addition to what so many of you already use through the state HIE, Health Current, you will also have access to an electronic closed-loop referral system to access services that address social needs. This electronic system will help you know if the service is available and if a referral was accepted by a provider. No more guessing about things just hanging out there in the universe, never knowing what happened about a social issue that needed to be addressed. By utilizing real-time electronic data sharing between and across providers, we will be able to expand on the interprofessional and interspecialty care of members who need multiple viewpoints. This truly takes the concept of team and expands it to a new level, thereby empowering previously siloed providers to operate as a team, including social services providers that can be interwoven into the daily structure of care. While we all see progress, we all also see how much more can be done with technology. While some of these things may seem far-fetched, we are in the process of improving the ability to have real-time data and developing tools that will allow this to happen without adding 10 more clicks, 5 more phone calls, 3 more faxes, and 20 more emails to your time with your member. 2020 has shown us technology solutions are not beyond us and in fact make us more effective and accessible. For a while, almost everything we did was virtual connectivity. And we learned that for many, this was the preferred way of interaction, saving time and hassle of having to even get somewhere. By continuing to embrace technology, we can bring forth and push tools out to members and allow them to have access to their real records, their real-time data, to help with scheduling, look at labs, access treatment-specific information about their condition, and ultimately helping them not only feel like they are a part of their care, but actually feel empowered to impact their care and wellness. With the increase in interactivity of these tools, patients will be able to visualize their progress in their chronic health conditions, their measures of satisfaction, and their ability to understand the role they themselves play in their own health care. We can utilize technology to facilitate prevention and improve health by adding things such as reminders for appropriate health screenings, Something as easy as sharing recipes with affordable nutritional ingredients that fit their cultural identity. As we accelerate the onboarding and utilization of these tools, we will be able to increase the efficiency and effectiveness of the face-to-face time we spend with the members and their family. With the integration and utilization of these tools and systems of care, we should begin to see significant improvements in outcomes as compared to non-integrated or non-technology supported systems of care. And moving along to other integrated practice tools, it's important to stay focused on the ultimate outcomes of health and well-being and to use tools that focus our attention on the goals set together with the members and their family. With this in mind, we will continue to advance reimbursement approaches, really that match to outcomes rather than just payment for delivering a service. As healthcare and support providers, we will be able to create user-friendly informational dashboards to see how much positive impact our work has had on the well-being of the members we serve. Those that have gone above and beyond, adopted an approach focused on whole person care, worked to connect and collaborate with other parts of the treatment team, and has supported this change and innovation, should see their alternative payment type reimbursements match these efforts. So, where are you on this journey? If you've watched this video to this point, my assumption is you're interested. With this interest, what are you willing to do for your next steps? What are the things you will change in your next patient encounter? What innovations will you push your system to make rapidly so that the members and your system can reap the benefits? Changing practices to advance integrated healthcare takes more than just a commitment. It also requires collectively learning with others on how to do integrated care and how to try new things together. Learning collaboratives are organized initiatives that bring together individuals with a professional community to learn new things together to ultimately have positive outcomes. A few examples of national learning collaboratives include things like the Institute for Healthcare Improvement, or IHI collaborative model for achieving breakthrough improvement. Another example is the National Council's Health Integration Framework Learning Collaborative, which focuses on integration of general health into behavioral health settings. Access's Targeted Investment Program is also an example of a collaborative here in Arizona, focusing on sharing best practices that have been tried and had success, and measuring outcomes rather than just process measures, helping to identify if the health and well-being of those we serve is improving. There are many examples of these learning collaboratives to support advancing integrated whole person care approaches. Let's listen to Megan from Jewish Family and Children's Services to see how participating in the TI program and Quality Improvement Collaborative has benefited them and enhanced their members' experience.
Our member experience is also very different now. Members can receive their physical health, their behavioral health, and their pharmacy services all in a one-stop shop location by visiting one of our integrated clinics across the valley. Overall, JFCS has seen tremendous benefit from participating in the Targeted Investment Program. We've seen an increase in our client base and the types of services that we offer. We've seen a rise in our care coordination efforts, and we've discovered new ways of monitoring and assessing member outcomes.
There are many different ways for you to be engaged in learning collaboratives. It can be within your organization, within your local health and social services community, at the state or national level. Take the time to know what learning collaboratives are available to you, or for that matter, how to form one if there's not one already underway in your community. Armed with all of this information and a vision for what the future can hold, we hope that you will lean in on this journey to create a truly integrated system of care, which helps to improve the whole health and well-being of our members, increases the ability to connect and collaborate amongst the team members, and are overtly supportive of change and innovation. With the utilization of technology and modifying your practices to improve outcomes, we will be able to create the system of the future today. Access is committed to supporting efforts that advance practices and tools to advance the integrated care or whole person care within the delivery system. AHCCCS supports all providers across Arizona to continue to advance integrated whole person care practices and tools so that we collectively work with members to achieve their health and well-being goals. Continue to look for updates on AHCCCS's website to learn about the latest initiatives underway. Thank you.